Welcome to another lecture by MedicoMedics, Medical Terminology, Chapter 4, Anatomy-Specific Terminology, Part 3. In this lecture, we will briefly cover the reproductive system and its terms, pediatric terminology, geriatric terminology, do a practice and application run, and end with a summary. So in this lecture, we will discuss the medical terminology related to the reproductive system, which covers the male and female reproductive organs. The pediatric terminology, covering infants and children. Geriatric terminology, covering older adults. So let's begin with the reproductive system then. The reproductive system is responsible for producing offspring. When we talk about the male system, we talk about, for example, the testes, the vas deferens, the prostate, etc. When we talk about female reproductive system, we're talking about ovaries, uterus, fallopian tubes, etc. Now going back to medical terminology then, some key word roots. Gynec, meaning woman or female. If we talk about the study of women and female, we would say gynecology, so the study of female health. Obsteter, meaning pregnancy or childbirth. So if we say obstetrics, we talk about the care of pregnant women. Ander, meaning male. So if we say andrology, we are talking about the study of male health. Uter, meaning uterus. So uterine is relating to the uterus. Test, meaning testes. If we say testicular, we are talking about something relating to the testes. Some common reproductive system terms then. Hysterectomy, meaning the removal of the uterus. So hyster means uterus, ectomy was removal. So hysterectomy. Oophorectomy, removal of an ovary. Ophor meaning ovary, ectomy, removal. Orchitis or orchitis, inflammation of the testes. Orch meaning testes, itis, inflammation. Ectopic pregnancy, so pregnancy outside the uterus. Ecto means outside, and the IC here, or ic, is pertaining to. So ectopic pregnancy, pregnancy outside the uterus. Now let's move on to pediatric terminology. So pediatrics focuses on the medical care of infants, children, and adolescents. Infants and children have unique anatomical and physiological needs. Now, going back to terminology here, we have ped or ped, meaning child. So pediatrics, the study of children's health. Neonat is newborn. So neonatology is the study of newborns. Congenit means present at birth. So when we say congenital, we talk about a condition present at birth. You might have heard about the term congenital disease. So it was a condition present at birth. Anat meaning development. So anatomy meaning the study of structure and development. Now, common pediatric terms. Neonatal, so pertaining to newborns. Neo means new, natal, birth. Congenital anomaly means a condition present at birth. So congenit comes from present at birth. AL here means pertaining to, and then an anomaly, meaning an irregularity. So an irregularity present at birth. Congenital anomaly. Failure to thrive means poor growth in infants or children. Another term is meconium aspiration, meaning inhalation of newborn stool during delivery. Meconium means the first stool. Aspiration means inhalation. Now let's move on to geriatric terminology here. So geriatric focuses on the health and care of older adults. As you know, aging brings unique health challenges, including chronic illnesses and degenerative conditions. Now, what are some keyword roots here? Ger means old age. So geriatrics is the study of health in older adults. Presby, aging. So presbyopia, age-related vision loss. Arthur, joint. So arthritis, joint inflammation. Osteo is bone. So osteoporosis, the weakening of bone. Some common geriatric terms could be osteoporosis, weakening of the bones. Another one is dementia, so cognitive decline with aging. Arthritis, joint inflammation again. Sarcopenia, muscle loss due to aging. Sarco means muscle, penia, deficiency. So sarcopenia. So moving on then to some practice and application. So let's decode these terms. Gynecomastia. So gyno or gynec, meaning female. Mastia means breast. So male breast tissue enlargement. Pediatric cardiology. So ped is child. Cardi, heart. Ology, study of. So the heart study in children. Pediatric cardiology. Presbycusis is presby is aging. Cusis is hearing. So age-related hearing loss. So in summary then, the reproductive terms describe male and female reproductive health. Pediatric terms addresses health from birth through adolescence. Geriatric terms focuses on health in older adults. So understanding these terms is crucial indeed for providing age-appropriate care. And that's the end of this lecture. Continue now to Chapter 5,